Top 25 Advanced Practice Nurse Interview Questions and Answers. Advanced Practice Nurse interviews assess far more than clinical knowledge. Employers want to understand your decision-making, patient assessment, communication, leadership, evidence-based practice, and ability to work independently while collaborating with healthcare teams. In this guide, you will find 25 Advanced Practice Nurse interview questions with sample answers. These responses are designed to help you explain your clinical experience clearly, demonstrate confidence, and show how you prioritize patient safety, quality care, ethical practice, and positive outcomes in challenging healthcare situations. Thoughtful preparation can help you communicate your strengths with professional confidence. 1. What are the key responsibilities of an advanced practice nurse? An advanced practice nurse combines clinical expertise with strong assessment, diagnostic, treatment, education, and leadership skills. I focus on delivering safe, evidence-based, patient-centered care while considering each patient's preferences and circumstances. I also communicate effectively with physicians, nurses, patients, families, and other professionals. My goal is to improve outcomes through careful clinical judgment, prevention, health education, and coordinated care. I continuously update my knowledge so my practice reflects current standards and reliable evidence. This approach supports safe, effective, patient-centered care. 2. How do you approach patient assessment and diagnosis? I begin with a systematic assessment that includes the patient's history, symptoms, medications, vital signs, physical findings, and relevant diagnostic information. I identify urgent concerns first and then develop a prioritized differential diagnosis. I consider evidence-based guidelines, patient preferences, risk factors, and available resources before deciding on management. When uncertainty exists, I seek appropriate consultation rather than making assumptions. I document my reasoning clearly and reassess the patient to evaluate whether interventions are effective. This approach promotes safety, consistency, and better outcomes. 3. How do you ensure patient safety in your practice? Patient safety is always my first priority. I use thorough assessments, medication reconciliation, clear communication, appropriate monitoring, and evidence-based protocols to reduce preventable harm. I also encourage patients to ask questions and participate in decisions about their care. If I identify a potential error or unsafe practice, I address it promptly, communicate respectfully, and follow reporting procedures when necessary. I believe a strong safety culture depends on accountability, teamwork, transparency, continuous learning, and consistent attention to clinical details. This supports clear decisions and positive patient outcomes. 4. How do you prioritize care when a patient has multiple health problems? When a patient presents with several problems, I first identify any condition that could threaten life or cause rapid deterioration. I then rank the remaining concerns according to urgency, severity, risk, and potential impact on the patient's health. I communicate priorities with the healthcare team and involve the patient in decisions whenever possible. I organize investigations and treatments accordingly while monitoring for changes. This approach helps me remain focused, efficient, and responsive without overlooking important secondary concerns. This promotes accountability and high-quality clinical practice. 5. How do you explain complex medical information to patients? I explain complex medical information using clear, respectful language that matches the patient's health literacy and cultural needs. I avoid unnecessary medical terminology and use examples or visual explanations when helpful. After explaining a diagnosis, treatment, medication, or procedure, I use teachback by asking the patient to describe the information in their own words. I encourage questions and address concerns without judgment. This approach helps confirm understanding, supports shared decision-making, and improves adherence to appropriate care plans. This supports thoughtful decisions and appropriate follow-up. 6. How do you handle difficult conversations with patients or families? I manage difficult conversations by remaining calm, respectful, and focused on understanding the patient's concerns. I listen without interrupting, acknowledge emotions, and clarify what the patient expects from the care team. Then I explain clinical information honestly, including limitations, risks, and available options. By staying calm, listening carefully, and focusing on goals, I can reduce tension, preserve trust, and guide difficult conversations toward solutions while protecting safety and patient dignity. This helps me provide reliable, respectful, and effective care. 7. What does evidence-based practice mean to you? Evidence-based practice means integrating the best available research with clinical expertise in the patient's values, preferences, and circumstances. In my practice, I review current guidelines, credible research, and organizational protocols before making decisions, especially when managing complex or changing conditions. I also consider whether recommendations are appropriate for the individual patient rather than applying evidence mechanically. This approach supports safer decisions, improves consistency, and helps ensure that treatment plans are clinically sound, practical, and patient-centered. This approach promotes safety, consistency, and better outcomes. 8. How do you approach medication management? I approach medication management carefully because medication errors can have serious consequences. I verify allergies, current medications, doses, indications, interactions, contraindications, and relevant laboratory results. I consider the patient's age, kidney or liver function, adherence, and ability to understand instructions. I educate patients about purpose, dosing, side effects, and warning signs, and I encourage them to report concerns. I document changes accurately and coordinate with pharmacists and other clinicians when additional review is appropriate. This approach supports professional judgment and patient-centered decision-making. 9. How would you respond to a medical emergency? I respond to emergencies by staying calm and following a structured approach. I quickly assess airway, breathing, circulation, level of consciousness, and other immediate threats, then initiate appropriate interventions within my scope and training. I call for additional assistance early and communicate concise information to the team. I continue monitoring the patient while documenting significant events and responses. After stabilization, I participate in debriefing and review what occurs so future emergency responses can be strengthened. This approach improves safety, trust, and continuity of care. 10. How do you maintain patient confidentiality? I maintain confidentiality by following privacy laws, organizational policies, professional standards, and secure information practices. I discuss patient information only with individuals who are appropriately involved in care and have a legitimate need to know. I protect electronic records, avoid discussing cases in public areas, and verify identity before sharing information. When family members request details, I consider the patient's authorization and applicable requirements. Respecting confidentiality builds trust and protects both patients and the healthcare organization. This approach supports clear decisions and positive patient outcomes. 11. How do you collaborate with physicians and other healthcare professionals? I collaborate by communicating clearly, listening to different professional perspectives, and keeping the patient's goals at the center of decisions. I share relevant assessment findings, explain my clinical reasoning, and ask colleagues for input when their expertise can improve care. If disagreement occurs, I remain respectful and focus on evidence, patient safety, and shared objectives rather than personal opinions. Strong collaboration requires reliability, timely communication, mutual respect, and willingness to adjust plans when new information becomes available. This approach strengthens teamwork and patient safety. 12. How do you manage a heavy workload? I manage a busy workload by first identifying urgent clinical priorities, time-sensitive treatments, and tasks that directly affect patient safety. I organize remaining responsibilities according to deadlines, complexity, and available resources. I use structured notes, reminders, and effective delegation when appropriate, while maintaining accountability for delegated activities. I also reassess priorities as patient conditions change. Staying organized, communicating early about potential delays, and avoiding unnecessary interruptions help me provide safe care during demanding shifts. This approach keeps care organized, responsive, and evidence-based. 13. What would you do if you made a clinical error? If I make or discover a clinical error, I address the patient's immediate safety needs first and notify the appropriate clinical leaders according to policy. I communicate honestly, document accurately, and participate in required reporting processes. I also examine contributing factors rather than simply assigning blame, because understanding system weaknesses can prevent recurrence. I believe professional accountability means acknowledging mistakes, learning from them, supporting transparency, and taking concrete steps to improve future patient safety. This approach promotes confidence, clarity, and clinical accountability. 14. How do you evaluate whether a treatment is working? I evaluate treatment effectiveness by establishing measurable goals and monitoring symptoms, examination findings, laboratory results, functional status, adherence, and patient-reported outcomes when appropriate. I compare current findings with the expected response and determine whether the plan should continue, change, or stop. I also ask patients how treatment affects their daily lives and whether barriers are limiting success. Regular reassessment allows me to identify ineffective interventions early and make informed adjustments based on evidence and individual needs. This helps ensure safe and individualized patient care. 15. How do you handle a patient who refuses treatment? When a patient is hesitant about treatment, I first explore the reason rather than assuming non-compliance. Concerns may involve side effects, cost, cultural beliefs, previous experiences, misinformation, or misunderstanding. I listen carefully, provide accurate information, discuss benefits and risks, and offer reasonable alternatives when available. Shared decision-making helps patients participate meaningfully in their care. If the patient ultimately declines a recommended intervention, I respect informed choice while documenting the discussion and providing appropriate safety guidance and follow-up. This approach keeps patient needs at the center. 16. How do you know when to consult another healthcare professional? I recognize my scope of practice and understand that advanced nursing responsibility includes knowing when additional expertise is needed. If a case exceeds my competence, involves unusual complexity, or requires a specialty procedure or opinion, I seek consultation promptly. I provide the consultant with relevant clinical information and continue appropriate monitoring while coordinating care. Asking for help is not a weakness. It is a professional responsibility that protects patients and supports accurate, collaborative decision-making. This approach strengthens clinical judgment and communication. 17. How do you respond when a patient's condition suddenly changes? I respond to changes in a patient's condition by reassessing the patient rather than relying on previous assumptions. I review vital signs, symptoms, examination findings, medications, laboratory results, and recent interventions, then determine the level of urgency. I notify appropriate team members, initiate necessary interventions within my scope, and arrange escalation when required. I document the change and response clearly. Frequent reassessment and timely communication help prevent deterioration from being missed or addressed too late. This approach promotes safety, consistency, and better outcomes. 18. How do you use technology in advanced nursing practice? I use clinical technology as a tool to improve safety, efficiency, communication, and continuity of care. Electronic health records help me review information, document assessments, track results, and communicate plans. I also use approved clinical decision support resources and monitoring technologies when appropriate. However, I do not allow technology to replace clinical judgment or patient interaction. I verify important information, protect digital confidentiality, and remain alert to inaccurate data, alert fatigue, and system limitations. This approach supports professional judgment and patient-centered decision-making. 19. What is your approach to leadership as an advanced practice nurse? Leadership for me means taking responsibility for patient outcomes while helping the team work effectively. I lead through clear communication, clinical competence, professionalism, and respectful decision-making. I support colleagues, address concerns early, and encourage a culture where questions and safety issues can be raised without fear. When appropriate, I delegate based on competence and patient needs while maintaining oversight. I also look for opportunities to improve workflows, education, and quality, rather than focusing only on individual tasks. This approach promotes accountability and high-quality clinical practice. 20. How do you participate in quality improvement initiatives? Quality improvement begins with identifying a meaningful problem, reviewing relevant data, understanding contributing factors, and selecting an achievable intervention. I work with the team to establish measurable goals and monitor results over time. If the intervention is ineffective, I reassess the process and make adjustments rather than assuming the original plan was sufficient. I value patient feedback as well as clinical indicators. Sustainable improvement requires teamwork, consistent measurement, communication, and willingness to learn from both successes and failures. This approach encourages teamwork, safety, and continuous improvement. 21. How do you provide culturally competent patient care? I respect cultural differences by avoiding assumptions and asking patients about their beliefs, preferences, communication needs, and health practices. I adapt education and care planning when appropriate while maintaining safety and professional standards. If language barriers exist, I use qualified interpretation services rather than relying on family members for complex medical communication. Cultural humility means recognizing that I do not know everything about another person's experience and remaining willing to listen, learn, and adjust my approach respectfully. This approach keeps patient needs at the center. 22. How do you stay current with nursing knowledge and clinical practices? I maintain my professional development through continuing education, current clinical guidelines, peer discussion, reflective practice, and review of relevant research. I identify knowledge gaps from patient cases and use them as opportunities for targeted learning. I also stay aware of changes in standards, technology, medications, and evidence that may affect my role. Continuous development is essential in advanced nursing because clinical practice evolves, and patients deserve care that reflects current knowledge, sound judgment, and professional competence. This approach supports quality, safety, and trust. 23. How do you handle stress and pressure in a clinical environment? When workload becomes overwhelming, I prioritize patient safety, communicate with the team, and reassess which responsibilities require immediate attention. I delegate appropriate tasks, ask for assistance when necessary, and avoid allowing stress to compromise clinical judgment or communication. I use organization and brief pauses to maintain focus during demanding situations. Afterward, I reflect on what contributed to the workload and identify improvements. Managing pressure effectively means staying composed, seeking support early, and maintaining reliable patient-centered care. This helps protect patients while supporting quality outcomes. 24. What are your greatest strengths as an advanced practice nurse? I would describe my greatest strengths as clinical assessment, communication, critical thinking, adaptability, and patient advocacy. I can analyze complex information, identify priorities, and explain care plans in a way patients can understand. I also value teamwork and recognize when another professional's expertise can improve an outcome. At the same time, I actively seek feedback and professional development because advanced practice requires continual growth. My goal is to combine strong clinical reasoning with compassion, accountability, and consistent attention to safety. This supports safe and individualized patient care. 25. How do you handle ethical challenges in nursing practice? I handle ethical challenges by identifying the patient's rights, safety concerns, professional responsibilities, and relevant policies. I gather the facts, avoid personal assumptions, and consider ethical principles such as autonomy, beneficence, non-maleficence, and justice. I communicate openly with the patient and appropriate team members while protecting confidentiality. When a situation remains complex, I seek guidance from experienced colleagues, ethics resources, or organizational leadership. My goal is to reach a fair, informed decision that protects the patient's interests. This approach promotes safety, consistency, and better outcomes. Preparing for an advanced practice nurse interview requires more than memorizing answers. Focus on connecting your clinical knowledge with real examples that demonstrate sound judgment, compassion, teamwork, leadership, and patient-centered care. Practice explaining how you assess situations, communicate with patients and colleagues, manage priorities, and respond to unexpected challenges. Use these 25 questions as a preparation framework, then personalize each answer with your own experiences and achievements. With preparation and confident communication, you can make a strong impression and demonstrate your readiness for nursing responsibilities. Remain honest, concise, and professional.